This is the Emergency Medical Minute, sponsored by Health One.
So I'm going to come out with a really shocking statement here. Smoking is bad, okay? And you know how bad smoking is. How many, if you're a smoker versus a non-smoker, about how many years do you lose off of your life? 20, 10. It's actually between 20 and 10. So the average years lost for a male is 13.2. And for a female, sorry, it's worse. It's around 14.5. So it's a pretty significant amount if you're a smoker that you lose off of your life expectancy. Smoking is really interesting. You know, nicotine is a chemical that has receptors all throughout the body, throughout the brain, and it's one of those chemicals that if you're feeling sleepy and down and you smoke, you feel more awake, and if you're feeling nervous and you smoke, suddenly you feel more calm. So it's got some really interesting things that make it very addictive. Plus the fact that when you smoke, it's basically you put a cigarette to your lips and then within a minute, you've got a bunch of nicotine in your brain and you get that instant relief. So there's a few things that make it, really addictive and really hard to quit. There's a few things, and I'll just run down a list of pertinent things that sometimes I'll point out to patients when I'm trying to really talk to them about quitting smoking. One is, it causes cataracts, so you go blind earlier. We all know the risk of throat cancer, lung cancer, coronary disease. There's a big risk for females, early menopause, so you go into ovarian failure much earlier. The fact that it screws with your estrogen means that people who smoke have really bad osteoporosis, so there's a lot more fractures earlier on. And then for men, I tell them that they're going to go impotent very early too, right? One of the best times to tell someone to quit smoking is when they have kids, right? That's a really strong motivator for a lot of people who are adolescents to really start trying to turn their lives around. And the things that I try to tell them is, one, the biggest predictor of your child smoking is seeing mom or dad smoke. And if your son or daughter starts smoking, then they're going to lose a decade of their life. If you're smoking around your kid's going to have a much larger chance of SIDS, sudden infant death syndrome, right? And you're increasing their cancer risk. So it's something that I think sometimes we just forget, right? In terms of our ER care. But you'll be amazed. Sometimes it's just consistent messaging and giving that message in the right way. And anytime someone's in an ER with a smoking related complaint, or when you identify a mother who's smoking and has a young child, I try to take the extra 2 minutes just to give a little counseling to try to get them to quit. So smoking's bad, okay?
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.